Hi everyone, I am Dr. Vamsha Vardhan P. I am General Laparoscopic and Endoscopic Surgeon in Srikara Hospitals, Vijayawada. Today we want to discuss about inguinal hernia and the various types of hernia, how are they presented and what are the regular complications people present to our hospital and what are the types of management, how we deal with hernia. Coming to hernia, hernia is just a defect of the abdominal wall from where the contents of the abdomen are protruded out. Most of the times we see intestine which is there inside the abdomen which is protruding out, and we see the omentum, it's a fat which will be coming out as a protrusion into the hernial sac. And coming to the other type of hernias, we deal with umbilical hernia and incisional hernias. These are the three major chunk of hernias what we get. Umbilical hernia is just a natural umbilical defect which will be increased in size due to abdominal wall weakness, and patient will be developing a small outpoaching and a bulge at the umbilicus, and he will be having pain most of the times. Coming to the incisional hernia is a site where patient already got operated at the same site and patient will be having a bulge outpoaching at that area, and most of the contents the contents include intestine and fat. Coming to the incisional hernias, it is the site where previously patient gets operated to some other reason like hysterectomy most common times or cesarean section, and due to this weakness created by the surgical scar, patient will be having pain and outpoaching at that same area, and this is called incisional hernia. Coming to the first stage where patient will be having pain and just a bulge at the site of the hernial site, and this is the common presentation where we generally encounter coming to our OP. Coming to the second stage include patient presenting with outpoaching which does not reduce, it will not go back inside the abdomen. Patient will be having continuous swelling in the abdomen which will not reduce. And coming to the third stage, this is called an obstruction strangulation stage. Strangulation stage is a stage where the contents of the abdomen like intestine will get entangled in the hernial sac and patient will be having pain. Due to this entanglement, the blood supply will get compromised and there will be no blood supply to the intestine which is outpoaching, and patient will be having severe pain, fever, and patient will be having obstruction features like constipation and vomitings. This is due to the entrangled intestine getting necrosed. To prevent such complications, there are many surgical options at the early stages so that we can plan the surgery accordingly early, and so that it will give a lot of benefit to the patient, and it will help the patient in preventing the complications. Coming to the surgeries, generally there is a open surgeries what people used to do in previous times, like open surgeries for inguinal hernia and umbilical hernia and incisional hernia. Nowadays, due to advancement in the techniques, advanced laparoscopy surgeries for inguinal hernias include TEP and TAP, and in these hernias, a small incision like 1 centimeters to 0.5 centimeters, like around 3 to 4, will be put on the abdomen, and because of these small incisions, patient recovery will be good, and patient will not be having so much of pain post-operatively, and patient will be getting discharged early, and patient compliance will be very good. Coming to the other hernias like umbilical hernia, we got IPOM and IPOM plus, where 3 small incisions will be put on the side of the abdomen, and all the contents which are protruding to the intestine in the hernial sac are reduced, and the defect is closed laparoscopically, and a small dual mesh is put intraperitoneally, and if the defect is closed, it is called IPOM plus. Coming to the incisional hernia can also be done in laparoscopy. In this setting, all the contents of the hernial sac is pushed down inside the abdomen, and the defect is closed with a suture material laparoscopically, and a mesh is put intraperitoneally. These 3 surgeries are the recent advances which are being done at Srikara hospitals, and these techniques are patient friendly, and patient acceptance is very good, and early discharge and patients' compliance is very good for such surgeries. These are the surgeries which are commonly done here in Srikara hospitals, and patients' reviews and patient compliance are very good, and they generally are happy with the surgeries which are being done at our hospital. Thank you.